Well, over the last year, the excitement about a national health insurance policy, the policy was expected to change the state of basic health care in the country, especially for the less well-to-do. However, over the time, there have been concerns that the government is planning to use the national insurance service as an extra tax, some of whom who are already covered. With a debate on the matter due to start in Parliament, we have Alana Kembabazi, the program manager for the Right to Life program at the Initiative for Social and Economic Rights, to help us appreciate this matter. Welcome to NTV Talk of the Nation.
Thank you. I'm glad to be here today.
It's an honor to have you. Now, for starters, your organization has been on the record saying that government is going to use this as an extra tax to impose it on the middle class, true?
Not quite. I think that we must remember why national health insurance exists. National health insurance is supposed to be part of a way of achieving universal health coverage. It is not the only way, but the central premise of universal health coverage is to make sure that everyone can be able to achieve health care regardless of ability to pay. And the idea is you get together a bunch of people through a pooling mechanism, and the healthy will subsidize the really sick, and the rich will subsidize the poor in a lot of ways. Over time, we've seen Uganda try to come up with a national health insurance scheme, and it's finally before Parliament, and there have been different versions around this. In earlier engagements, there was a lot of concern that the scheme would particularly for workers in the formal sector, would
middle class.
Yes, would be an additional burden. And I think that in earlier drafts of the bill, not the current bill before Parliament, but for example, the 2014 bill, it put 4%, it asked formal sector workers to contribute 4%, and the employers would ideally match that as well. Then there was a discussion about whether or not government would contribute 1% as an employer. Government are one of the biggest employers, right? But one of the things we urged the ministry at the time, and still urge Parliament to consider, is that in a number of other countries, that percentage has also, instead of having a situation where the deductions for NSSF, deduction of pay, and now deduction in NHIS, we're urging them to think through how to sort of harmonize those deductions in a way that doesn't hurt as well the workers. And some countries have done that. So
is there any other way government could, in one or the other, improve the health insurance coverage for the poor without turning the insurance into an extra tax?
Well, there are a couple of things. Like I said, first of all, government is a primary duty bearer here. True. And what's not clear right now in this current version of the bill is whether it says indigents will be covered, and it defines indigents as the very vulnerable poor. So the poor refugees, the poor person with disabilities, poor older persons, but it's not clear about whether or not government will cover them. Now, in prior versions of the bill, the ones that we saw that did not quite get to Parliament, that the Cabinet approved, it was very implicit that government would cover the poor. And at the time, Ministry of Finance's certificate of financial implication had said government would cover 10% of the poor at a time. Right now, we are urging the parliamentarians to really scrutinize this, because to avoid the burden being passed on, there is no way in which the national health insurance scheme would work without government coming in and putting in money and subsidizing. Every single country where it's done. The payments, yes, to some extent help, but for it to be sustainable and to ensure the poor are covered, government has come in and put in money, and right now it's not clear. The second thing we've said again is really harmonizing. You don't have to deduct NSSF, deduct the workers, so now a deduction on NHIS, and look at what other countries have done. They've said, for example, to do that, to harmonize that, we may need to amend the NSSF Act. And those are discussions that have happened, but we haven't really seen a lot of progress on them.
Well, so tell us about what you mean by, for one to take up this mandatory national policy insurance policy, in addition to the current coverage one may have. Can't one be avoided?
No. And it has to be very clear. The National Health Insurance Scheme, it's supposed to be mandatory. You're all supposed to be a part of it. And that's part of the beauty of it, actually. If you have everyone, the more people you have, right, the more you're really sort of subsidizing in a lot of ways. But it does allow you to have supplementary insurance, so the private health insurance schemes will continue to function, and community-based health insurance schemes will continue to function. So it's not saying it's the only one, but it's saying that everyone will have to contribute to it. Another thing that I hadn't mentioned is for the informal sector, it's not been very clear. They've often been thought of as homogeneous, and you cannot say, for example, the informal sector should only contribute 100,000. Now, the bill doesn't quite say that. Earlier versions, the certificate of financial implication application brought up those discussions. The bill is actually silent on the issue of contributions and wants to leave it to the minister to regulate. And I think actually that these discussions should be happening right now.
So how do we charge the informal sector? How do we bring them on board, the inclusion?
Exactly. Those are the discussions we would want to see parliamentarians really bring on. Right now, one of the biggest gaps for the informal sector has been social protection, and national health insurance is a form of social protection. Most people become poor because they have a disease, they have to rush to hospital, and they don't have any other cover, right? But there are also ways around making sure that when you're charging the informal sector, it is commensurate with income, right? And the deductions are fair. So that's very important. The other thing is to think about how it's going to change the paradigm of how we thought about health insurance and health sector delivery. It's opening the door for the private sector to play an even bigger role in delivering health services. But we've also seen of recent in the news patients being detained because they can't pay. Most people don't get access to their records. Health insurance companies have come under loads of things. So you have to think about that.
Do you come from the school of thought with all this in place, people are not going to be, because look here, people are struggling to pay in private hospitals, which are extremely very expensive. So how will the national policy listen on this so that it's actually on the law? And why should those who want to retain or remain with their coverage also have to be a part of the mandatory policy you're advocating for?
Yeah, I think it will definitely help with the situation if done right. And that's why I'm asking about all these little nitty-gritty details, right? The issues about, is the government putting in enough money to cover the poor? Will they regulate the private sector health providers when they're in? Have they set up the environment right? Have they covered the informal sector? Because in what we've seen in other countries, and Kenya is an example where the ability to have national health insurance has really even helped improve the quality of care that's being provided. For example, under our proposed national health insurance scheme, the accreditation requirements. So if those are enforced, then the quality of health providers will have to go up, because to be a provider, you have to meet these accreditation requirements. But in terms of whether it will help making it more affordable, again, it comes back to the details. And what we are hoping Parliament gets into, as it's scrutinizing, it's taking submissions, I know this week, and possibly the next, it's really important we begin to hear from the people around some of these issues.
Have you heard of situations where money has been allocated and it went missing, or it was corrupted in one way or the other?
Right.
So, in this sense, the worries and the questions of the public has always been, how are we going to regulate? How are we going to put everything in check, right?
Yeah.
Going with the analogy, every day we hear about accidents on the road. But when you hear accidents, it doesn't mean you shouldn't drive or you shouldn't jump on a bike in a rush hour. But you take precautions. So how do we achieve that?
I think that's a very valid question about the governance requirements, because this scheme won't exist in a vacuum. We have to really rethink health governance in this country in a very scrutinizing manner. And the issues of accountability and participation. For example, on the scheme, there is a board, and there are lawyers who are part of the board, and managers of, health insurance schemes, and people with that level of expertise. But where is the citizen voice in that? Because that's one of the things. What we often see is a situation where these scandals come to Parliament after they've happened, right? There's that oversight is almost at the back end rather than being there throughout the process. And one of the things we're saying is make sure that the audits, and this scheme, to be fair, in the bill, for example, they say an audit will be provided to Parliament and so forth. But I think from the start, for example, having a citizen voice on the board, having different ways to interface with citizens can help with some of the governance issues. Is
there a chance that it can possibly work in the long run?
I think it will. I mean, throughout East Africa, most countries have. Rwanda has. Kenya, Tanzania has a form of it. In fact, for so long, we've been asked where is our national health insurance scheme, and all throughout. So if done right, and let me be very clear on this, if done right, and I hope the members of Parliament are really scrutinizing. If we have, the World Health Organization has said the number of unacceptable trade-offs. They've said a situation where you further privilege those who are well off at the expense of those who are not well off, like the poor, is an unacceptable trade-off when designing these schemes. So if we have a bill that actually results in a situation where us, the formal sector, those who have insurance, are further privileged, and the poor, the most vulnerable, those who are complaining about the high cost of healthcare are left out, then it won't work. So we need Parliament to get it right. Okay.
Well, you can join this conversation with, of course, Kemba Bazelana. Her handle on Twitter is capital A, Kemba, low score, that is a capital A as well. It was an honor to have you.
Thank you.
Well, there you have it, a conversation you need to be a part. Well, I'll take a break and I'll be back shortly with sports.